Understanding thick blood, a guide to risks and safety. Thick blood is a common way people describe blood that flows more slowly than normal. Think of it like trying to pump honey through a straw instead of water. This happens for two main reasons. Too many red blood cells, polycythemia. This creates a traffic jam in your vessels. It can be caused by polycythemia vera, PV, where your bone marrow makes too many cells, or secondary polycythemia, which is your body's reaction to things like smoking or sleep apnea. 1. Sticky blood, hypercoagulability. This is when your blood's clotting system is turned up too high, making it more likely to clump together even if you don't have extra cells. 2. 1. Why it matters, the big risks. When blood is thick, your heart has to work much harder to push it around. This increases the risk of heart attack, when a clot blocks blood from reaching the heart. Stroke, when a clot blocks blood from reaching the brain. DVT and PE, these are clots that form in the legs, deep vein thrombosis, or travel to the lungs, pulmonary embolism. 2, 3. Thick versus sticky blood, key differences and impacts. While thick blood often overlaps with sticky tendencies, especially in PV, where both issues can occur, they aren't the same. Differentiating helps explain varying risks for cardiovascular diseases. Thick blood, hyperviscosity from polycythemia, like too much traffic from excess red blood cells, making blood sluggish and straining vessels/heart mechanically. Hypertension, high blood pressure more directly linked. Thicker blood increases resistance in arteries, forcing harder pumping and often leading to chronic high BP. Studies show PV patients have higher hypertension rates due to viscosity interfering with vessel relaxation. 1, 10. Stroke and heart attack, high viscosity causes pooling, stasis, reduced oxygen delivery, and clot promotion. Untreated PV raises these risks 2 to 4 times, often combining mechanical strain with clotting. 1, 4, 11. Sticky blood, hypercoagulability, like an overeager clotting system, e.g., from genetic factors, hormones, or other conditions, focusing on biochemical triggers rather than cell overload. Hypertension, less directly caused, sticky blood doesn't thicken flow, though chronic clots can indirectly strain vessels. Hypertension may contribute to a prothrombotic state in some cases, but the link is weaker than in thick blood. 2, 12. Stroke and heart attack, driven by rapid clot formation in normal or even fast flow blood. Risks rise 3 to 5 times in severe cases, primarily through chemical pathways, e.g., excess thrombin or factor imbalances. 2, 7. Both elevate overall cardiovascular risks, e.g., clots in arteries/veins, but thick blood adds a mechanical layer, while sticky focuses on clotting ease. In PV, both often coexist, amplifying dangers. 1, 2. 2. Early warning signs. Many people don't feel any different at first, but watch for neurological, headaches, dizziness, or blurred vision. A flushed face, your skin looks very red, as if you have a sunburn. The shower itch, a very specific, stinging itch after a warm bath or shower, doctors call this aquagenic pruritus. 4. Strange bleeding, even though the blood is thick, your platelets might not work right, leading to frequent nosebleeds. 1. 3. Emergency signs, act fast. If a clot forms, it is a medical emergency. Use the B.E.F.A.S.T guide for strokes. Balance, dizziness, eyes, vision loss, face, drooping, arm, weakness, speech, slurring, time, call 911 immediately. 3. 4. What makes it worse? Dehydration. Not drinking enough water makes your blood more concentrated. Staying still, long flights or sitting at a desk lets blood pool in your legs. Hormones, birth control or hormone replacement therapy can increase stickiness, too. 5. How doctors help, the diagnostic workup. Your doctor will use a multi-pillar approach to confirm the diagnosis. 1. 4. CBC and hematocrit, to measure the physical thickness of your blood. The gold standard is keeping the hematocrit, HCT, below 45%. The JAK2 mutation test, a blood test to see if a genetic, broken switch, is causing overproduction. The EPO level, to check if hormone levels are abnormally low, suggesting the bone marrow is acting on its own. Bone marrow biopsy, to inspect the cell factory directly for scarring or overcrowding. Diagnosing thick versus sticky blood. Diagnosis begins with symptoms and basic tests but branches based on the issue. For thick blood, polycythemia emphasizes cell volume and production, as above, CBC/hematocrit first, JAK2, EPO, bone marrow. Red flags include high HCT, greater than 49% men, greater than 48% women, and viscosity symptoms like flushing/headaches, 1, 4, 8. For sticky blood, hypercoagulability focuses on clotting function, often after a clot, coagulation tests, PT, APTT, INR, specific factor assays, e.g., factor V Leiden, protein C/S, D-dimer for active clotting, and screens for acquired causes, e.g., antibodies. Red flags, unexplained clots, family history, or no high cell counts, 2, 7, 9. PV can cause secondary stickiness, so tests may overlap. Early specialist input, hematologist for thick, coagulation expert if needed, ensures accurate targeting. Common treatments. Phlebotomy, the fastest way to thin blood by physically removing extra cells, similar to blood donation. 5. Aspirin, usually a low dose to keep blood cells from clumping. Targeted meds, drugs like hydroxyurea or interferon help slow down the cell factory. Emerging in 2026, rusfertide, an investigational injectable, NDA submitted to FDA January 5, 2026, that helps the body naturally regulate iron and red cell production, potentially reducing the need for frequent blood removals. 6. The goal. For most patients with thick blood, the gold standard is keeping the hematocrit, HCT, below 45%. Anything higher significantly increases the risk of a traffic jam, clot. Myth number 1, I'm on aspirin, so my blood isn't thick anymore. The truth, your blood is just as thick, viscous, as it was before, but it is now less likely to clot. You still need to manage your hematocrit, HCT, levels through hydration or phlebotomy to reduce the mechanical strain on your heart. Myth number 2, drinking water is just as good as a blood thinner. The truth, hydration is vital for preventing temporary thickness, dehydration, but it cannot stop the bone marrow from overproducing cells in conditions like PV. It's a support tool, not a cure. Myth number 3, if I'm not bleeding easily, the medicine isn't working. The truth, the goal of low-dose aspirin in thick blood cases isn't to stop all clotting, but to keep platelets slippery. You don't need to see bruising for the medication to be protecting your brain and heart. Safety note, because thick and sticky blood often occur together, especially in polycythemia vera, doctors usually prescribe a combination of treatments, like phlebotomy plus aspirin. One clears the traffic, the other prevents the crashes. Seven, healthy habits. Drink water, keep that honey moving by staying hydrated. For PV, polycythemia vera, patients, consistency is key. Spikes and dips in hydration can cause significant fluctuations in how they feel. Keep moving, flex your ankles and walk every hour. Quit smoking, smoking robs your blood of oxygen, signaling your body to make even more thick, red cells, too. Watch out for iron deficiency paradox. Some patients with thick blood try to cut out iron-rich foods. However, this can lead to iron deficiency, which sometimes makes the blood cells larger and less flexible, actually worsening flow. Safety note, never try to thin your blood yourself with supplements or aspirin without a doctor's green light. Always consult a hematologist for specialized care. References.